Assalamualaikum and good morning to one and all. Today we'll study about part 2 of pharmacoeconomics. So before going ahead, let's quickly see what we have seen in a part 1 of this chapter. So part 1 of this chapter, we have studied about the definition of pharmacoeconomics and we have seen why there is increase in spending on the drug therapy and especially on the drug in India in last few years. I am Professor Sheikh Abu Sufyan. Welcome you to my YouTube channel Pharma Learning Forever. At the end of this e-learning session, you are able to discuss factor affecting the drug pricing and explain the need, challenges and components of pharmacoeconomics. So let's start with the factor affecting drug pricing. So the first factor which affect the drug pricing, it is the sector in which medicine are purchased. So sector it means whether drug it is purchased under private sector or it is purchased under government sector. So if the drug it is purchased from the private sector, since all the private sector they are having the profiteering intention, so they keep the price with the margin of their profit. So if you are purchasing the drug from the private sector, then obviously it is going to add into the cost of that particular drug. Whereas if you purchase from the government sector, you need to spend little less as compared to the purchase of the drug from the private sector. So this is how the sector in which medicine are purchased, it also going to affect the drug pricing. The second important factor, it is the type of procurement agent. So here we will be talking about the procurement agent. For example, the different prices may be paid for the same product by a public sector purchaser such as Ministry of the Health. So Ministry of the Health, if they are purchasing the medicine on behalf of the government and if they are purchasing directly from the industry, then such drug can be given to the Ministry of the Health by the industry under subsidized rate. And if as a consumer, if you take medicine from the Ministry of the Health or the government agency or the government hospital from where the medicine come from the Ministry of Health, then you need to spend little less as compared to directly purchasing medicine from the private agent. Okay, so the procurement agent or the person who is responsible for procurement of the drug, if he is someone which is the individual entity or if he is the public sector purchaser such as the representative of Ministry of the Health, then he may get same medicine at a lesser cost directly from the industry. So this is how the procurement agent it also going to affect the drug pricing. Third important thing, it is the distribution route that you have selected for the distribution of the drug. For example, a patient who purchase medicine at the hospital pharmacy, they may have to pay more. Now why? What is the reason for paying more amount if they are purchasing medicine directly from the hospital pharmacy? Because the hospital pharmacy they purchase the product from local wholesaler. It is unlike the Ministry of the Health, they directly purchase it from the industry, whereas the hospital pharmacy they purchase from the local wholesaler. Since they purchase the drug from the local wholesaler, they have to spend little more. So since hospital pharmacy spend more on the purchase of the drug, obviously the consumer or the end user they will get the drug at little higher price as compared to same drug if they are going to purchase it from the government hospital or government agency, right? So this is happen because the distribution the route it is something else. In case of second factor, that was the procurement agent related to government agency, we have seen the distribution was directly from the pharmaceutical industry, whereas in case of hospital pharmacy, since they want to take the limited stock, so as a result of that the industry will not directly give to the hospital pharmacy, they have to purchase medicine from a local wholesaler. Okay, and it is going to add the price into the drug. So this is the third factor. In addition to that, many a time hospital pharmacy may have limited stock of the generic drug, and when hospital pharmacy they have limited stock of the generic drug, there is no choice to the patient, but the patient has to purchase only branded drug because since they are in the limited stock of the generic drug. So in that case, the only option remains with the patient, it is to purchase the branded drug in the emergency condition. Okay, and if they are purchasing branded drug, then the cost of the drug will be high as compared to the generic or non-patented or non-branded drug. So this is how the cost of the drug it is changed depending upon the sector of the purchase, the procurement agent involved, and this distribution of the drug. Depending upon that, the price of the drug which is getting to the end user or the consumer, it is a little high. Okay, so we have seen three factors till now. The fourth factor, it is the patient status. Okay, so if the someone who having good financial condition, then in that case that patient will not purchase it from the government hospital, and he will not also purchase the generic medicine, rather he prefer purchasing the branded medicine, and as a result of that, due to patient status also, there is increase in a price. Okay, so under patient status there are few factors and we'll see those factors. So one of the factor, it is the patented medicine, and do remember that the all new medicine coming to the market, they are patented one. Old medicines are not patented, and since these are patented one, it will add more price to that particular medicine, and as a result of that, only those who can afford that medicine can purchase it. Okay, whereas the general population who cannot afford cannot purchase those medicine, right? Why? Because the price of patented medicine, it is higher than that of the generic equivalent. So this could be one of the factor under patient status. Second factor could be, or rather there are many other factors which influence the total cost of the drug, are the price of patent, non-patented and generic drugs. So we have already discussed this, and we have seen that the price of patented drug it is high as compared to non-patented and generic drug. Likewise, whether consumer, whether he is purchased the drug from the retail or wholesale markup, right? Whether he is purchasing from the retail store or from the wholesale store. So the retail having different the markup, whereas wholesale they having the different benefit markup. Wholesaler they generally take the less benefit out of the medicine, whereas retailer they take the more benefit out of the medicine, and due to that this price markup will add into the cost of the medicine depending upon the whether the consumer purchasing the medicine from the retail store or he is purchasing the medicine from the wholesale store. Okay, so this is the second important factor. Third, it is pharmacist professional fees. So pharmacist professional fees is not at all the problem in the countries like the India, because in the India the pharmacist generally doesn't charges their professional fees, right? But they charge the salary, and when they charge the salary, the cost it is added into the sometime into the drug and the product, or the amount of margin it is kept in the some of the medical shops. Somewhere they give sometimes the 10% concession, sometimes some medical shop they doesn't afford to give the concession to the consumer. Okay, so this is happened because of pharmacist professional fees. Rather, in case of other western countries, pharmacies they charge the fees, and due to charging the fees in addition to the price of the drug, that fees is also added into the cost of the therapy, and as a result of that, overall pharmacotherapy become little expensive, right? So this is the due to the pharmacist professional fees. In addition to this, there could be change in composition of total population. Example, the proportion of the older person. For example, in particular region, if the proportion of older person if it is more, then in that case those medicine which are used for the older persons are in more demand, and as a result of that, those medicines, since they are in a more demand, they will be sold at little expensive price. So again, depending upon type of drug, type of manufacturer, they are having different strategy in order to improve the sale of the drug and also to maintain their own benefit. Okay, so the change in composition of total population, it also going to affect the price of the drug. Then changes in the prescribing habit of the physician. So if the prescribing habit of physician, if it is changed, for example, if you see the physician from some slum area, obviously they will not prescribe medicine which are expensive. They will try to prescribe the generic medicine, because the end user coming to them, they are not good economically, they will not afford the medicine if they start prescribing the expensive and branded medicine. Whereas if you go to the central Mumbai and those particular area, so their standard of living is high, the people they are belong to the rich population, so they can afford the even branded medicine, even the better quality of the healthcare. So as a result of that, the physician in those particular area, if you are going there, then they have prescribing habit of giving the medicine of the highest price or maybe of the branded medicine. They won't prescribe you generic medicine, or they won't prescribe you non-branded medicine. So the change in prescribing habit of the physician of that particular region will also affect the total spending which is related to the healthcare, or the total spending which is drug on the drugs. Okay. In addition to that, the change in utilization of the drug, that is number of drug used per patient. There are certain physicians, they prefer not giving many medicine, whereas there are certain other physicians, they prefer giving combination of medicine. So if the number of medicines per patients are increases, obviously it is also going to add into the price of the drug, and that is depending upon the type of disease patient suffer from. It is also depending upon the type of physician he is going, right, and many other parameter. It also decide that how many number of drug to be used per patient. Okay. Then next, it is the trend toward using newer drug therapy instead of the other treatment. So if the newer drug therapies come into the market, and do remember that the newer drugs are under patent law, so they are sold at higher price. So if they in particular region, if there is trend of using only newer therapy, only advanced therapy, if that is the case, then in that particular area, the physician will also prefer giving the newer drug therapy. And when patient goes to the physician, he will prescribe newer drug therapy, and it will add into the price of the medicine, and total pharmacotherapy become expensive, because there is trend in that particular area to use the newer drug therapy instead of the other treatment. Okay. So this is how we have seen the different factor which affect the price of the drug, and it is going to either increase the price, it is going to add the burden on the patient, the wallet, or it is going to decrease the price of the drug. So we have seen the different factor. Now let's see what is the need of pharmacoeconomic study. Why pharmacoeconomic study it is needed? So pharmacoeconomic study is needed in the different sector. So in case of the industry, they need pharmacoeconomic study, because in case of the industry, they need to decide among specific research and development alternative. So based on the pharmacoeconomic study, they decide whether to go ahead with the particular study or not, whether to go ahead with the alternative development or not. Okay, because they spend huge amount on the development of the drug, and if there is no equivalent demand in the market, then there is no sense in spending those amount in the development of that particular medicine. Okay, so deciding among specific research and development alternative, so that is the one of the way by which industry decide this, by doing pharmacoeconomic study. So that is the one of the important needs, especially for the industry. Second need could be in case of the government agency, especially to determine the program benefit and the price paid. So if you just look at the polio vaccination process, then initially when it was started, it was available at subsidized price, right? Whereas when it was continued further, then it was made completely free in the government hospital. So government hospital polio vaccination was completely free. So this was done based on the benefit that is given to the larger number of the population, right? Amount of the price that is the government has to pay to the pharmaceutical industry for the procurement of those vaccine, right? So that also it is decided by the government agency by doing pharmacoeconomic study. So that is very important in case of government agency in determining the program benefit and the price paid. So likewise now the program benefit especially in case of COVID situation, they have put on the cap of the ICU beds. Even in case of private sector, they have put cap on the ventilator beds. Likewise, the only quarantine bed. So they have put some cap on the pricing. So this they did by doing pharmacoeconomic study. So the government, they decide or they determine the program benefit and the price paid by the government to the pharmaceutical industry or to the different stakeholder. It is decided based on pharmacoeconomic study, right? So this is the need for in government sectors or to the governments. Third, what is the need in case of the private sector? Especially in the private sector, pharmacoeconomic study help you for designing the insurance benefit coverage, because do remember that nowadays the drug therapy or pharmacotherapy, it is very expensive. It is not an affordable, or it is not possible without insurance to get the good pharmacotherapy, right? So in private sector, the pharmacoeconomic study help you in designing the insurance benefit coverage and designing the policy related to the insurance. So these are the three important need of pharmacoeconomic study in the industry, in the government sector, and in private sector. So I have done with my first part of the session. So before going ahead with the second part of the session, let's have the quick question and answer. So my first question is, enlist factor affecting the drug prices. I'm expecting your answer in the chat box. So let's see who give the first answer. The factor affecting the drug prices. So we have seen the several factors which affect the drug prices. So to start with, at least you must mention about 2 to 3 factors which affect the pricing of the drug or the drug price. Okay, so Nurun is mentioned about the distribution route. Yes, so distribution route play very important role. Patient status, it also going to affect the price. Raunak mentioned about the sector in which medicine are purchased, the type of procurement agent and distribution of the medicine, right? So you have summarized everything, Raunak. Arjuman Logde mentioned about distribution route. No, okay, mention about profiteering intention. So if profiteering intention, especially in private sector, it is there. So if that is the case, it is also going to add into the drug pricing. Very good. Then sector in which medicine are purchased. Saki mentioned about type of procurement agent. So different pricing may be paid for the same product by the public or the sector and the private sector. Yes. So we have seen the different factors which affect the pricing of the drug. Let's move on to the next question. So my next question is, what is the need of pharmacoeconomics in the industry? So just now we have seen there are three important needs in the industry, private sector, as well as in case of the government sector. So out of that, what is the need of pharmacoeconomic study, especially in case of the industry? Yes, I can see. I think the Ronak has given the answer. In industry, it helps in deciding among the specific research and development. Okay, so industry, the important role it is on deciding on specific research and development. So whether to go ahead with a particular research and development, so that is decided based on pharmacoeconomic study, because they spend lot of money in the R&D, and if they will not get the proper demand to that particular medicine, then there is no sense in spending money in the development of that medicine and also manufacturing of those medicine. Okay, so the pharmacoeconomic study, it help you to decide the industry to take that particular decision which is related to the drug or research and the development. Okay, so let's move on to the second part of the session. So in second part of the session, we'll see the what are the challenges for doing pharmacoeconomic study. So the first challenge is in the pharmacoeconomic study, it is establishing the guidelines or the standard of practice. So it is very difficult to establish the guidelines or the standard for the practice. Why it is difficult? Because these guidelines, it is difficult to standardize, because the pharmacoeconomic study, it changed from where it is conducted, then why it is conducted, what is the nature of pharmacoeconomic study. Since it is very dynamic in nature, so it is very difficult to establish the particular set of the guideline or the standard of practice which is related to pharmacoeconomic study. So this is the first challenge. The second challenge, it is very difficult to get the stable funding to support applied pharmacoeconomic research, because if you want to do the research in pharmacoeconomics and come to the conclusion, you need a manpower, and you need the qualified manpower, right? And you need the machinery, you need the system, and you need infrastructure, right? So to do this, you need a stable funding. So getting stable funding to do the pharmacoeconomic study, it is also the challenging task, and it is the hurdle rather between the pharmacoeconomic study. So this is the second challenge. Third challenge, it is the creating a cadre of the trained producer. So now there is the acute deficiency of the trained producer of pharmacoeconomic work. So there are the less people who are the trained in pharmacoeconomics are available in the market, and as a result of that, it is a big challenge or hurdle for doing pharmacoeconomic studies. So you need to create the more trained producers of pharmacoeconomics work if you really want to implement the policy related to pharmacoeconomics. Fourth and last challenge it is the continuing education for the practitioner, then government officials and the private sector's executive. It is also the challenge because giving education to them, because practitioners they are always busy, the government official sometimes they are busy and sometimes they don't want to take the training or the continuous education related to pharmacoeconomics. Likewise, the private executive they are also very busy. So since they are busy and also the sufficient the trained producers or trainers are also not available, so continuing education for the practitioner, the government officials, then private sector executive, it is also big challenge for doing pharmacoeconomic study. So there are four important challenges that we have seen, that is establishing the guidelines, stable funding, creating a trained producers, and the fourth one it is the continuing education. It is the challenge for doing pharmacoeconomic study. Let's move on to, I think we have did the inner background study related to pharmacoeconomics. Now we'll see what is the aim, objective and principle of pharmacoeconomics evaluation. Why basically you are doing this study, right? What is the aim of this study and what is the principle behind pharmacoeconomic evaluation? So whenever you are doing the study, you must keep the aim and objective of this study in front of you. You keep their basic principle before you, and then you can plan the pharmacoeconomic evaluation. So let's see the aim and objective first. So the first aim and objective it is to reduce monetary burden on the consumer. So do remember that you are doing pharmacoeconomic study basically to reduce the burden on the consumer. You don't want to give much financial burden on them. You want to make available the drugs at the cheapest price to the consumer or at the affordable prices. So you need to take the efforts to see that there is less burden, monetary burdens on the consumer. So when there is less monetary burden on the consumer, this is only possible by ensuring a global pricing strategy for effective management of healthcare system. Because now the pharmacotherapy is a little expensive, rather it is much more expensive, and it is out of reach of common person, right? Unless they having some insurance policy or they have some policy, and with the help of that policy they can go to the hospital and they can take the cashless service. So if you can have able to implement this ensuring global pricing strategy for the effective management of healthcare system, then obviously it is going to reduce the monetary burden on the consumer. So this is the first objective. Second objective, it is to take the decision about the drug therapy. Without pharmacoeconomic study, even government agency, the private sector and industry, they will not able to take decision about drug therapy. Which drug it is to be continued, which drug it is to be given to particular treatment based on the drug price and the affordability and benefit to the patient. So that is also decided based on pharmacoeconomic study. Okay, so these are two important aim and objective to reduce monetary burden and to take the decision about the drug therapy. Let's see what is the principle behind pharmacoeconomic study. So the principle behind pharmacoeconomic study, it is quite clear. It is to make more efficient use of limited resources. Now you might have heard in last few days there was the news in Maharashtra there is the deficiency of the vaccines. Some of the vaccine centers they are closed due to the deficiency of the supply of the vaccine from the central government and from the central agency. And then they have written the letter with the through the central ministry to provide those particular drug therapy, right? So to make more efficient use of limited resources, the important task it is the pharmacoeconomic study. Without that you cannot make more efficient use of the limited resources. Okay, so now why you are doing or why you want to make more efficient use of limited resources, it is done for maximizing the healthcare benefit at the lowest price, right? You want to offer the healthcare benefit to the larger population at the lowest price. If you want to do that, then for that purpose the major principle you need to apply it is the pharmacoeconomic study principle. That is, you want to see that your pharmacoeconomic study help you to provide more efficient use of limited resources for maximization of healthcare benefit at the lower cost. So you need to keep into mind both aim and objective before framing or before planning for pharmacoeconomic study. Okay, let's move on to the component of pharmacoeconomic study. So the first component of pharmacoeconomic study is the health outcome research. So there are total of 5 components of pharmacoeconomic study. One of the component is the health outcome research. So although we'll see in a detail in my subsequent lecture, but just in today's session I will brief you about what exactly it is. Okay, so do remember that the health outcome research, it is something related to the relation between the price and the total outcome or the health outcome to the patient, or total benefit that patient is getting out of that particular treatment of the drug. So the relationship between the price and the health outcome it is done, and that type of study is called as health outcome research. So this is the first component of the pharmacoeconomic study. Second component, it is the disease burden, where you are studying the relationship between the price and the disease burden. For example, now our all healthcare system, they are overworked, and the lots of burden it is there due to COVID-19, right? So the price is also important parameter there, because Ramsdevils and some life-saving drug, they are not available at the cheaper rate, they are available at expensive rate, right? So this is also going to add into the disease burden, because if the treatment is available to the large number of population at the cheaper rate, or maybe at a free of cost, then it helps you to reduce the disease burden. Okay, or rather, if that is not possible, then it is going to add into the disease burden of that particular area. Okay, so this is the second component. Third component is the health economic. Obviously, the main important component is the health economic. You need to work out how much the government is going to spend on the health, how much the consumer can spend, how much pharmaceutical industry can spend. So that is decided based on the health economic study. So that is the third component. Fourth component, it is the health policy research. You cannot do pharmacoeconomic study, or sorry, you cannot develop health policy without doing pharmacoeconomic study. So the health policy and their relation between the price, if you are doing that study, it is called as health policy research, right? And lastly, it is the health technology assessment. What do you mean by health technology assessment? For example, the one technology which is very novel and which is very innovative and provide a maximum benefit to the patient can be affordable to the US population, but same technology cannot be affordable to the Indian population, right? So this assessment it is done, and based on that, the particular the pharmacotherapy or the novel technology which come into the markets, it given the permission to be used in the particular area, right? So this decision has been taken based on the health technology assessment. So you need to do the assessment of the health technology, and based on the health technology assessment, you can take the decision related to whether to continue with that technology, or whether to use any new technology coming to the market, or in which region it can be used. So you can see the highly technology related the healthcare system, it is available in the metro city like the Mumbai, Hyderabad, and some cities like the Kolkata and the Delhi. So they provide all sophisticated technology. But if you go to the rural area, you may not get this technology, because obviously the people will not able to afford those technology. So this decision it is taken based on health technology assessment. So that is the fifth important component of pharmacoeconomic study. Okay. So we have seen the five component of pharmacoeconomic study. Let's move on and see the seven way of cost measurement. How you are measuring the cost. So to measure the cost, there are seven important ways. So the first way, it is the cost per unit. Okay. So the cost per unit means the cost which is related to per medicine or the per treatment. Okay. So the cost per unit is the first way of measuring the cost. Second way, it is the cost per treatment can be measured, right? Likewise, the third, it is the cost per person can be measured. Fourth one, it is the cost per person per year. What is the burden of the price or the cost of the spending for entire year? It is also calculated. So that is the cost per person per year. Fifth one, it is the cost per case prevented. For example, to prevent the per case of related to COVID-19, how much cost it is to spend to the government, how much cost to be spent by the individual patient. So if you are calculating that, that is called as the cost per case prevented. Next one, it is the cost per life saved. Suppose person is dying, you have used a ventilator, you have used a life saving drug, right? So to save that particular life, how much spending you done, so that is called as the cost per life saved. So that can also be one of the way of calculating the cost measurement. Seventh one, it is the cost DALY. What is the delay? Cost per delay. So delay, it is disability adjusted life year. that, for example, if you are not giving treatment to the patient, if you are not spending in terms of the treatment, then maybe that patient it is disabled for those particular years. But if you can spend the money, then money, and also you can take the treatment, then obviously the disability adjusted life will going to reduce. So the cost per delay it is also calculated, or it is also one of the way of measuring the cost related to the drug. Okay, so I have done with my today's session, and we have seen the need of pharmacoeconomics, factor which affect the drug pricing, the different component of the pharmacoeconomics, and 7 ways of the calculating the price. So I have referred the Sumit Kumar Ashish Balti. It was the good articles on the internet. It is available. It is published as a principal methods and economic evaluation of the drug therapy in Pharma Tech Medicines in 2013. So I must thanks to the author of this article for providing this wonderful information for the benefit of the students and the healthcare fraternity. So thanks for watching my session. For more such learning, subscribe to my channel, and if you like my today's session, then do remember to give me a thumbs up.